Hi everybody, welcome to this video interview. This is Parker from the marketing team. I'm joined today by Dr. Michael Hall, who we last talked to in New York City as he was helping on the front lines there. He is now in a quarantine actually in Virginia, and we thought we would follow up with him and talk with him today about some of the lessons and things that he learned from New York and what he's currently up to and when he'll be back to Ogden Clinic. Dr. Hall, it's great to see you and be with you today. How are you doing?
I'm doing good. Thank you, Parker. How are you been?
I'm doing good. Thank you so much for asking. Well, it's great, like I said, to hear from you. It has been a little while since we have heard from you. And since your time in New York, a lot of time has passed. A lot of changes have happened. We just wanted to follow up to see if you could kind of explain what's happened, where you are at now, and just explain for our audience how what changes have happened in your life since we've talked last.
Yeah, I can't remember specifically when we talked last, but our mission completed in New York. Basically, we were there during the peak of when they were having their COVID-19 cases. I think we were there. I think the single day highest was like 799. So basically 800, and that's deaths. So 800 deaths per day. Now they're in New York. They're under 100 for the state. So, I mean, dramatic difference in the number of deaths, new cases, hospitalizations, everything. So at this point, they're able to handle the influx of new patients, and the hospital's not overrun. So they've moved us, most of us. There's still a few people left in New York from the Navy teams, but there's by far the majority of us are now out of New York City, and where most of us are here in Virginia. If people know where Norfolk, Virginia is, Portsmouth, Norfolk area, I'm in Portsmouth. I'm sitting in a hotel. They officially call it restriction of mobility, ROM. True quarantine means that I have to be staying in my room full time. But I'm actually able to get out of my room. I can't do a whole lot. The property here is about 300 yards long and about 100 yards wide. So I can get out, I can go do what we call PT, which is physical training. So I can go for a run, or I can go push-ups or different things like that. But I have to stay within that 300 by 100 yard section of property and 6 feet away from everybody else.
Wow, that is crazy. So are you the only person from your group at the hotel, or are there a bunch of you there?
So, and I guess I should preface that the group in general, the entire Navy group, when you include the Comfort, the Mercy, the Javits Center, and then those of us who are on the teams that were sent into the hospitals, there was about 800 of us total reservists.
Okay.
In the groups that were sent directly into the hospital, there was a little over 200 of us. And those were broken down into teams that went to specific hospitals. My entire hospital group is here, but not all of the people that were sent into the hospitals are here. They're actually spread out to different places.
Okay.
The Comfort folks have all gone home. They went home about a week ago. The Javits Center folks are supposed to go home either today or tomorrow. I still have about a week left here in Virginia. And then as long as I test negative, then I'll be coming home.
Well, that's good to know, and we really hope that that's what happens and that we're able to see you soon. Just jumping back to your time in New York, were you able to leave earlier than you had anticipated, or did you guys stay for the same amount of time that you had planned to be out there?
We were anticipating being there about 2 months, and that's about what it ended up being. Once I go through this quarantine period, it'll be about 2 months. There were some concerns that we were going to be extended. My original orders were for 2 months. Those then got extended to September, actually.
Wow.
Because they were concerned at the height of it that it was just going to keep going. Mm-hmm. But then they cut those back, and they brought us out of New York in a staggered fashion. My hospital was one of the first ones that was allowed to pull their clinical people out because we kind of got our hospital a little more under control quicker. But my role there was basically I was in the ICU the entire time. We were put in charge, a group of surgeons, orthopedics, plastics, urology, general surgeons. We were actually put in charge of an ICU. And so we ran the ICU. As the numbers started coming down, we closed our ICU down. And then I guess we did a good enough job. They actually took our team and moved us and put us in another ICU and put us over that ICU. So we basically were in charge of taking ICU patients, COVID patients, and then helping them to a point where they, hopefully get better. And if they don't, eventually the numbers drop until we close the ICU. So we ended up closing down 2 of the ICUs to a point where with their regular staff, they were able to handle what they had.
Awesome. Well, thank you for sharing that with us. And I'm sure this is an experience that will have a forever impact on your life. And I did want to ask, is there any sort of lesson that you have taken away from your experience in New York?
You take a lot from this kind of thing. I think, just an appreciation for what we have. It's so easy to kind of go through life and just kind of hit our daily routines and little things that get us out of our comfort zone, like dog getting out of the yard or something like that gets us all upset. I think we all are going to take from this experience, all of us as people, that sometimes we just need to kind of let little things be little, and kind of just be able to roll a little bit better and be appreciative of what we have, and show gratitude for the things that we have. Complain less.
I like that.
Maybe think about things like that.
Yeah.
Perspective on where we are and what we're doing.
Yeah, I completely agree with you on that. I know that even just being here in Utah, seeing everything that's been happening, your perspective does change, and you gain a greater appreciation for the small things, for relationships, for people, and those interactions that we so miss sometimes. And so I can completely agree with you there. Jumping back to your time in New York, I wanted to ask another question. If you had any sort of standout experiences that you would be able to share with our audience.
Yeah, I mean, there's patient care things that were certainly unique for me, but also just interactions with people. The group of people that I'm with, we're all doctors and nurses from all over the country. These are people I never met a single one of these people before. They all come from different backgrounds, different specialties, and within this military community, which I'm new to, there just becomes an incredible bond of friendship and camaraderie and working together, and of the many things that I will take from it. That, I think, is going to be probably one of the top things. It's just the connection to people and the appreciation. Someone that you don't even know who lends a hand and helps you out, and you do the same for them, and that kind of camaraderie that has been here present during this, with not just because it's military but because of the situation, has really built a bond that it's hard to describe. And also the people back home, just the incredible amount of support, like unbelievable, like how many people have called or sent me a package or a letter or shoot me a text just out of the blue. Hey, just thinking about you. And it's almost, it's almost incomprehensible that so many people would care enough to just shoot you a text and say, just thinking about you. And And I think going back to what we were saying before, Parker, I hope we never lose that. I think that's what all of this has brought us to a better understanding, better appreciation for people and what we have and how we interact. And time is going to dampen it to some degree. We just hope we never lose that, because that's something, if we're going to take some positives from this experience, certainly that is going to be one of them.
Yeah.
From a clinical standpoint, again, this was not my wheelhouse. These are very, very sick ICU medical types of patients, which I was trained for 20 years ago, but it's been a while. If I were to say anything, I would, my very first few days were pretty dramatic here, in New York. The 10-bed ICU that we ran, we probably lost 4 to 6 patients a day. And, the situation where they're very, very, very sick, patients, families couldn't come into the hospital. Nurses had been working for 21 straight days. Not having the hospital being overrun. It was just this crazy. It's hard to explain, and I don't know that I'm doing a good job, but even more than what I've described, and more than what most people even understand from watching it on TV, how difficult, how dramatic, how chaotic, how sad it was in those first few days. And one patient in particular, I remember, when we call it coded, what that means basically when they start to go down. And so you call a code, which means basically you have a team respond to do CPR and to give medicines to try and bring them back. My patient, my very first patient that coded, we called it code, and the code team was already busy somewhere else. So I then had to run that code, meaning I was in charge of getting people in and giving the medicines and instructing people, you do the CPR and you do this and that. That's something that an orthopedic surgeon doesn't do that often. And that experience and then subsequent experiences related to her, she eventually did not make it. But that was something that, like you asked when earlier questions, is there anything that changed you? Well, that probably did. Just you develop just an introspective care about people when you're trying to save their life. I don't know,
Yeah.
In such a direct way that, anyway, that was a moment for me during this whole process. Was the very first time I had to run a code.
Thank you so much for sharing that experience with us. I mean, I'm sure that was very hallowing for you as a provider and physician and a caretaker of those patients. And so thank you for opening up and letting us get a glimpse into that. I think there's a lot that we are unable to see, being so distant from New York and in such a different situation. And I think it helps us really kind of open our eyes and see that this is a big problem and kind of a scary thing. But thank you for being vulnerable and willing to share that with us. So moving forward and looking forward, we know that you have plans to come back to Ogden Clinic, and can you kind of give us a timeline as to when you expect to be back?
I'm in day 10 and 3 hours. So I actually finished my quarantine time here on Friday of this week. So today's Tuesday. So this Friday is my last quarantine day. At that point, I have to take a test, the COVID-19 antigen test. So, and that usually takes a few days to come back. It is on a weekend that we're getting the test done, so who knows if it takes 2 days, 4 days. But so long as that turns up negative, then I can come home, and then it's just a matter of the Navy basically booking me a flight and getting me home. That could take a day or 2 or 3, but so I'm hopeful to be back sometime the first week of June. So
Wonderful.
Next week.
That'll be here before you know it. And wow, it's great to hear that you'll be able to come back, and we're excited to have you back. Just looking forward again, what is something that you'd want your patients to know now that you're planning on coming back?
Just grateful for everybody back home. Honestly, just people and partners, even patients. I've had patients send me little nice texts and things. It's just think, we have good people where we live, and it's we forget, again, be appreciative. Hopefully we never lose sight of that. We'll be back next week.
Awesome.
We'll have lots of stories. Most of my patients like to come in and we talk about golf and fishing and whatever. Now we'll have some more stories to talk about.
Well, that's great. And like I said, we're excited for you to be back with us. For those of you that have tuned in, this has been Dr. Mike Hall, who has been actually reporting from his quarantine in Virginia after serving in New York, helping on the front lines of coronavirus. Dr. Hall will be returning to Ogden Clinic soon, and we're excited to have him back. For more information about Dr. Hall or any of our other providers, visit us at ogdenclinic.com.